Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you. Welcome to another facilitation section on essential drugs, PHS 426. We'll be looking at topic 8, summary and overview of trends in essential drug supply. Some things we didn't talk about in the time, all the time we've been discussing essential drugs. This is our last lecture, so we'll be capping up with some of the things that we didn't mention in the previous classes. On topic 7 last week, we looked at what we call alcoholic beverages, uses and abuse of it, and we'll try to differentiate abuse from addiction. We looked at uses of alcohol and all that. So today we'll be looking at other trends and other aspects of essential drugs management that we haven't discussed in the course of our lectures on essential drugs. So at the end of this lesson, we will get to know what Bamako Initiative is and its elements, understand the objectives and advantages of the initiative. So what is Bamako Initiative? We've been hearing of Bamako Initiative. Now, Bamako Initiative, in the first place, Bamako is a town in Mali, West Africa. At the 37th World Health Organization Regional Meeting of African Health Ministers, that was in September 1987, the WHO African region, in collaboration with UNICEF, put up a proposal which was aimed at enhancing quality of health services to the people of the continent of Africa. So this happened in Bamako, like I said, which is a city in Mali. What were the elements of the proposal by WHO African region in collaboration with UNICEF in that conference or in that initiative? What were the elements of the proposal? They looked at setting up what we call cost recovery at initially donated supply of essential drugs at the local government levels. So when they donate medications, they try to sell those medications and get proceeds from such sales at the local government levels. And through that, they want to ensure regular supply of these essential drugs of good quality and at lowest cost for primary health care support. So despite the fact that they sell these medications and recover the cost of sales, they plow it back and then use it to make sure that there is a regular supply of these essential drugs, especially at the primary health care system. So that encourages what they call social mobilization initiative to promote community participation in policies of essential drugs and maternal and child health at the local government levels. So what were the objectives of the Bamako Initiative? The objectives were to provide, the major aim of that initiative was to provide what we call complementary and rational drug policy. That was what the major focus was, and the objectives were develop and strengthen what we call local financing and management capabilities of primary health care activities at the community and the local government levels. So the focus was on the primary health care to develop and strengthen their local finance and management capabilities. And it was also, the objective was also to promote locally supported and funded self-help schemes such as cost recovery system, the drug revolving funds. So we know what the drug revolving funds is. So the focus or one of the objectives of the Bamako Initiative was to promote that locally supported and funded self-help scheme at the primary health care levels, to make sure that they champion the drug revolving funds, so that funds that are usually realized from sales of those medications are plowed back into purchasing or replenishing stock in the primary healthcare centers to support their growth and development, and also to make sure that people are served and adequately served. So what are the advantages of the Bamako Initiative? Of course, the initiative has advantages. So what are those advantages? Bamako Initiative was actually meant to make drugs of good quality available to the people, accessible to the people, affordable to the people, for the treatment of common ailments and diseases amongst the community or the population. Now remember, in our previous lectures we talked about essential drugs, the focus on essential drugs, public health, pharmacology, and essential drug supply and management is to make sure that you provide good quality medications, and not just that you provide those good quality, you make sure that they are available, they are accessible, they are also affordable to the community, and they must serve the needs of the community. That means whatever that are prevailing medical conditions of the community, those drugs must be there to serve and provide those needs. That is one of the advantages of the Bamako Initiative. One other advantage is that it encourages community participation in the implementation of primary health care services. Now, one of the problems we have faced in community health programs, primary healthcare programs, is that we do not involve the community. The target community, the community that benefits from any program, must participate actively. And that's one of the definitions of the primary health care. It is not just a health care that is scientifically oriented, provided to the people, made affordable to the people, cost effective, but it also encourages community participation so that they feel that they belong to whatever you're doing, and in that way they make things work. So government alone should not dwell on just providing services, but also making the community participate in the progress of such services, so that such services can thrive and continue to grow. One other advantages of Bamako Initiative was that all these help to strengthen the healthcare delivery system through complementary role in the provision of essential drugs. So when community that have primary healthcare centers say that there is a kind of a revolving system where drugs, essential drugs that they need for day-to-day their day-to-day life and health needs, it continues to strengthen this healthcare delivery system, and people are able to participate more and get involved in things that matter to them and things that can improve their health. So, in summary, we've looked at what Bamako Initiative is and its elements. We've come to understand the objectives and advantages of Bamako Initiatives. Thank you for listening.